imagine graduating with a medical degree, late 90s, early 2000, and then forging ahead and thinking the place to go is community medicine. And remember, that picture meant a lot, and I'm going to still talk to you. That will be what I'm talking about. And so I was like, why community medicine? Why there could be other things? So in between, I struggled. I wanted to be, something else. The stethoscope was good on my neck. I thought, okay, cardiology could be there and blah, blah, blah. I just didn't get it. So I veer off and said, okay, let me go do this. Because those periods, the people we emulated, there's a popular word we use when we were in school. We say they use jeep to pursue mosquito. They're not in the clinic. All they need to do is get a good jeep, because that comes from grants and the rest of them, and move around trying to see what is happening in the community, and they appear wealthier than those who kept themselves in the clinic. So that's what we meant in medical school. So okay, so let's see whether we can actually use jeep to pursue mosquitoes. And you can't be in community medicine without pursuing mosquitoes anyway, because you must look at public health and look at health of the people. So I started and we moved on like that. When I got in, I told myself to carve a niche in a place where there are many ahead. You have to start looking for something else. And like our first speaker said, you evolve. So after a few were running residency and the rest of them, I thought, okay, so let's see whether we can have some data analytics skills. So I started writing papers. I joined people because they will need my skill. I will analyze the paper, I will earn mentorship. And so in that light, we continued the career. And then, so by the time I was leaving residency, it was clear in my head, having thought I wanted to pick up a senior post. Everywhere I attempted to think, I won't mention institutions, I negotiated to start at the level of a senior lecturer because I'd taken time to personally develop myself to that point. So I wasn't going to negotiate for anything less. Fast forward, things played out, and then we said, okay, this is what everybody say. The field where I'm writing is commonly called reproductive. I said, what would be new that I would do? Okay, can I try and concentrate and say, look, this is my field? So I started searching around, and one day I found out that, okay, if you're in reproductive health, you can pick a place and say maternal health, child health. So I said, all right, so I want to be a maternal and child health epidemiologist. Meanwhile, I'm clearing my head what I was doing. So just like joke, and then one university said, look, can you come as an external examiner? They said, what's your field? I said maternal and child health epidemiologist. The person was struggling. He said, okay, reproductive health, so that I can catch up with what I'm actually doing. And then one thing led to the other, and on like that. So while doing residency, there was a part of me that felt it was more than just being a physician. And so I started building networks of mentees. Once I'm a bit ahead of you, I pull you into my group deliberately. I was deliberate about it and started building on that. I'll talk to that just before I round up. So after a while and running through some of these things, gradually rising, I discovered that my head was not going to bend this way except I do something else. So I told myself I was going to evolve. I'll keep myself as an academic, I'll stand strong, but I'll do something else. So what was it? I made my first business attempt some 15 years or thereabout ago. And my first business attempt was 9 million naira. I went into oil. You can imagine my salary at that time, as a resident and blah, blah. And so I went into oil. We were supplying some big companies, and then the business ran into a hitch. We lost all the money. So I got a bit discouraged, and I told myself, you just got to do something else. Whereby, if they say, oh, there's a strike, the system is not working, you don't feel it. And then I move on, paid up the loan, and went into something else again, and started, and on like that. I kept it low, building my academic career, but veering completely in quiet manner into entrepreneurship. So from there I moved to College Services. Because I'm talking to young people, you won't even hear this in my CV because it's not part of my CV. So I moved into College Service, and then we moved for some of the larger beauty company in the nation. Again, resilience, choosing to go beyond your limits. We had issues in the business again, and then one day I sat down. My wife happened to be a neonatologist. I said, look, can we do something we truly know? So we made up our mind, let's veer into health service provisions. And that's where we are now. I won't talk too much into that. Health service provision, you understand what I mean? You could be in the lab, you could be in building of provision of health services within the clinics. And the driving force were really that, look, I got to make myself a bit different from the regular ones. Be sound academics, turn around and be sure that, look, even though I'm pursuing this, my head will eventually get bent like this. In other words, I can control the funds, I can control the money, and I can impact life by teaching, by training, and by mentoring. Thank you very much. I leave you with this. It looks so funny that was the driving force. There's always a dream in your heart. Ensure once you are clear about it, you don't move away from it. I wanted to keep my medical career, and sincerely, that gives me a platform, even in the midst of business people. When I talk and I say, some of my partners in college, they say, he's a doctor, what's he doing in college? At the point I fired to one of the biggest company in Nigeria, somewhere in Ibadan, I'll cover the name because I'm live. I was like, what's a doctor doing with this? And really, each time they sit down, they relate with me. They relate from the perspective that, okay, you are up there. If you're in this with us, I think we should give you that honor. And so that opened me more to some of the things I can do. So in the front, academics, I'm trying to hold on, cap manage, stand out in the midst of the cohorts. The other way around, I'm also ensuring that, look, whatever it is, I'm standing. And so one, as I leave, hold on tight to your dream, whatever it is that that's in your heart. Number two, you will never have a perfect situation to start. You will never have. If I tell you how I rake around the first 9 million, and if I'm saying 9 million 12, 15 years ago, you understand what I mean. I'm not talking now. And those periods, it was easy to pick up one income in 3 months. You want to buy what you can buy. So be sure that, look, you tell yourself that. And lastly, tell yourself, I'm going to be above every limit. I'm just going to be different. Sincerely, I've always wanted to be different. Different in appearance, different in comportment, different in what I do. Why I align with the general thing, so that somebody knows, oh, that's the guy. Thank you, and enjoy the rest of the day.